The first thing I tend to do is be really clear on my plan for deprescribing, withdrawing medications with my patients and their families if needed. What order those medications are going to be withdrawn in, the time frames you expect to do that in, and what the patient might expect in terms of changes in their body, rebound symptoms, so that they're more likely to adhere to the plan with you.
And for symptom control, the sort of reassurance of knowing that they can take it as they need it might be important too. So if I'm going to have a rich meal, then I might need to take my proton pump inhibitor, whereas if I'm just eating normally, I probably won't.
Yes, that's true.
Yeah. That withdrawal stuff is constantly a problem with high-risk drugs. You know, the benzodiazepines and the opioids. They're the ones that often you get withdrawal type features, which often mimic the condition that the drug was being taken for in the first place.
Yes.
And that creates a real complicated thing. If the patient's not properly educated about what might happen, they'll leap on that and say, well, this is because I've stopped my drug or I've cut it down, so therefore I have to go back to where it was. So.
And I think that's quite important that the GP in particular plays a key role in continuing to reassure and support that patient. And I often find that spacing appointments, actually making appointments quite close together so that patients are seen fairly frequently through this time tends to make it a more successful process.
Yeah, and certainly, I mean, you know, as in all things, the written information about, you know, what we're doing, how we're doing it, what sort of rate we're going to cut the drug dose down, and frequency is really important, as well as reminding patients, you know, why we're doing it. And the initial consultation obviously is fairly time consuming, but as you say, Amanda, if you're following things up to get a good result, then hopefully the patient will follow through on your rationale.
And the other point is to make sure that it's documented, because otherwise, you know, they go off and see someone else, and here we go again. You know,
yes, documentation is key. So you remember where you came from and why you did that, and you remember to communicate that to other people that you might choose to involve in their care, because that's a very useful starting point for any other health professionals.
And are you aware of any sort of resources for some drug classes withdrawal, Peter?
Look, there are some things. The alcohol and drug people, patient-focused things for benzodiazepines and proton pump inhibitors. It'd be nice to have more, but you know, often a good discussion, even with a pharmacist. If you're sending people for a medication review, you can ask the pharmacist to specifically target an issue like, you know, I'm targeting this person's benzodiazepine, their sleeping tablets. Can you talk to them about those before we have the discussion about stopping them and why? So